Chair calls Barbara Humphries, testifying on behalf of herself, testifying for both bills.
Thank you.
Welcome. Would you identify yourself and state your position?
Yes, my name is Barbara Humphries, and I am testifying on for HB 3785 and HB 837. Right now I would like to testify on HB 3785. My name is Barbara Humphries. I'm 31 years old, and for the last year I've been battling a very aggressive stage 3 invasive breast cancer. I went through 9 months of chemotherapy, had a double mastectomy, and I'm scheduled to begin radiation this next Monday. The side effects from the chemo were terrible. The nausea was unbearable. I was in excruciating pain. I couldn't eat. I had a lot of other side effects, such as not being able to breathe, allergic reactions. I had a blood clot in my jugular vein that could have killed me. I then was put on blood thinners that caused me to bleed out so much that I had to have a blood transfusion. I spent a good majority of my time in the hospital admitted. I made the decision to try marijuana to alleviate my symptoms because I didn't know what else to do. And I immediately noticed a difference. I could eat. I actually put on weight instead of losing weight like a lot of cancer patients do. And I no longer had to take my pain medication. I was able to have a relatively normal life. Medical marijuana could help so many other people who are sick and dying from cancer. It's been widely known for decades the benefits marijuana have on the symptoms of cancer and its treatments. At 31, I'm supposed to be vibrant and in the prime of my life, but instead I felt like I was dying. And everyone here knows somebody who has either had cancer or passed from cancer. And I want to pose one question. Why is it so bad for a patient to feel good? I would also like to testify on HB 837, and that's the affirmative defense bill, which could provide some kind of protection if I'm somehow caught trying to medicate myself. And by doing so, I would like to read a letter from my medical provider as an example. I have had the privilege to serve as Barbara Humphries' medical provider for the last 4 years. I was her provider when she was diagnosed with cancer, an especially aggressive and complicated type. I have closely watched her progress as she suffered through the pain of post-surgical care, the nausea of chemotherapy, the anxiety and fear of what will happen to her. A safe, effective, and affordable treatment option does exist, and it is marijuana. It has allowed her to eat, remain physically active, manage her anxiety and family obligations, despite the ravages of surgery, cancer, chemotherapy. She has remained an excellent, active member of our society. And what do we do for her as a community, government, and medical system? We criminalize her in her heroic attempts to save herself, her family, and her life. Medical marijuana is safe, affordable, and an effective treatment and must eventually be legalized, and I support her use of marijuana for the mental and physical benefits it offers. I am ashamed that as a medical provider, I cannot provide her with the medications that can make her feel well. I urge you to pass HB 837. Thank you. And I will accept any questions.
Thank you.
Thank you.
It takes a lot of courage to come up here and do that. So we admire your tenacity and your grit.
Thank you very much. That means a lot.
Well, thank you for being here. Are there questions, members? God bless you.